Sarah presented yesterday and was diagnosed with pneumonia. She had a fever, productive cough, shortness of breath, fatigue, loss of appetite, and chest pain, which can indicate associated pleuritis.
Pneumonia is caused by bacteria or viruses entering the respiratory zone of the lungs and causing inflammation of the respiratory bronchioles, alveolar ducts, and the alveoli. The respiratory zone is where gas exchange with the pulmonary capillaries occurs and is composed of simple cuboidal epithelial cells in the respiratory bronchioles and simple squamous epithelial cells in the alveolar ducts and alveoli. The presence of pathogens in the respiratory zone initiates an inflammatory immune response, causing changes such as filling of the alveolar spaces with leaking plasma and neutrophilic exudate, consolidation and air loss due to loss of surfactant, an increase in mucus production leading to mucus plugs, and a significant decrease in the effectiveness of gas exchange in the alveoli. This can affect the entire lobe or patchy areas alone.
Okay, let's take a look at some chest radiographs.
Here we can see some radiographs of the thorax. On the left we have a computed tomography or CT image. On the right is a plain radiograph or X-ray. In both images we can see the lungs appear as paired radiolucent structures that are conical in shape and relatively large. They are located lateral to the semi-radiopaque heart and just superior to the semi-radiopaque thoracic diaphragm. The intrapulmonary bronchi are visible as thin branches on the medial aspect of each lung and are semi-radiopaque. In CT, the intrapulmonary blood vessels appear as small semi-radiopaque specks within the lungs, but are not visible in X-ray. The ribs and clavicles appear as semi-radiopaque in X-ray and are superimposed over the lungs.
Plain radiography is the modality for diagnosing pneumonia because it's cheaper, accessible, and portable. The radiolucency of the lungs allows the denser infiltrates in the airways to be visible. Infiltrates are presented as white spots that are distinguishable from the bones. However, X-rays can provide false negative readings, and so we turn to CT for diagnosis. CT exhibits no superimposition, and the lung's soft tissues are presented as a semi-radiopaque structure. The bronchi and bronchioles are opaque, and consolidations associated with various classifications of pneumonia can also be identified, such as tree and bud nodules. However, this modality is more expensive and time-consuming. Although MRI is more suitable for viewing soft tissue structures, it is inefficient at detecting tree and bud nodules formed from the infections and is instead used to help understand the extent of the infection.
This image showcases a HIV-positive male in an anterior-posterior plain radiograph projection. Opacification is seen in the perihilar mid and upper zones or in the areas of primary and secondary bronchi. Radiopaque streaking and dots are also continuous throughout the respiratory zone and all lobes of each lung. These are easily distinguishable, despite being superimposed on the ribs, mediastinum, and heart. In comparison to the previous patient, this anterior-posterior plain radiograph of a healthy 12-year-old male provides the same radiopaque visibility of the mediastinum, heart, and ribs in the thoracic cavity. In contrast, the radiopaque streaking, dots, and opacification of the perihilar region are not present. However, semi-radiopaque structures lateral to the mediastinum and heart are present, and these are the primary and secondary bronchi. In addition, the respiratory zone is completely radiolucent in the healthy patient, in contrast to the infected individual.
Using plain radiography, pneumonia may be misdiagnosed as tuberculosis, effusion, thromboembolic disease, cryptocercosis, lymphomas, abscesses, or poorly differentiated adenocarcinomas. These respiratory pathologies also present in plain radiographic images as regions of radiopacity within the lower respiratory tract. Many pulmonary consolidation or lesion pathologies may resemble the ground glass opacities that generally typify pneumonia. CT scanning may be used to confirm diagnoses, as its 3D reconstruction capabilities and greater absorption spectrum allow more accurate diagnosis.
Risk factors for pneumonia include old age, lifestyle factors, existing or recent pulmonary conditions, and chronic comorbidities.
Oh, that's me.